Hey everybody, this is Dr. John Baird. I'm board certified in anti-aging medicine and I'm a functional endocrinologist. I want to say thank you for your interest in hormone replacement therapy and balancing out your hormones. But I wanted to go over a few of the hormones and just give you an overview so you know what you might be looking at in terms of your problems. I know you've taken the quiz and would love to set up a time to go over that with you. But the hormones in your body are like ring around the rosy. If one of them falls down, they all fall down. So what I wanted to go over was the most important hormones in your body and how they may be affecting you on a daily basis. The first one is insulin. So insulin is that hormone that goes up whenever you eat a carbohydrate. So carbohydrates are things like potatoes, vegetables, fruits, anything that we would call a starch, okay? When you eat those foods, including sugar, by the way, those foods cause your insulin to spike. And the whole idea behind insulin is it's supposed to bring your foods into your cells and use them for energy, okay? The problem with insulin is it's a fat storing hormone. And if you eat too many carbs too frequently, you can get what we call insulin resistance, which is pre-diabetes, which can eventually lead to diabetes. Insulin affects every single hormone in your body. And so it's really, really important to improve that from a dietary standpoint. And we always check insulin levels because it's easier to pick someone up for diabetes using that than a glucose level or a hemoglobin A1C. The next hormone that's a fat storing hormone is estrogen, okay? So estrogen is prevalent in women starting in their menarche when they start their menstrual cycles. And it's the highest in women's 20s and 30s during their years when they have children usually. And starts to go down in their 40s and 50s. Estrogen has over 400 functions in the body, and that's why it's so important. So what does estrogen do? I call estrogen the great lubricator, okay? If you have dry eyes or dry hair or dry skin as you go into your 40s and 50s, estrogen is the main reason. Estrogen builds the cartilage for your joints, so women have more arthritis than men do. Estrogen also is important for your moods and works with serotonin to make you happier and control your anxiety. It helps your sleep. It controls hot flashes and night sweats. It also helps you with your thought process so you don't have that brain fog. Most women come to me and say they forget phone numbers and people's names, etc. So I guess the next question would be, is estrogen safe? If you use Premarin, pregnant, mar, horse, in urine, it's a synthetic hormone that when you take orally causes inflammation. That inflammation can cause cancer, or heart attacks or strokes. We don't want that. Bioidentical hormone replacement therapy is safe. I've had over 10,000 women on bioidentical hormone replacement therapy, which is plant-derived, looks just like your own hormones, and really does make a difference in women's overall outlook in life. It does reverse the 4 leading causes of death potentially for women, which include stroke and heart attacks, Alzheimer's, dementia, bone fractures, and improving your overall health for sleep and moods, okay? So the next hormone that we want to talk about is cortisol. So cortisol is your stress hormone, and everybody has stress. 80% of doctors' visits are because of stress. So we know that whether it's stress in your marriage or your relationship or stress at work or stress from your kids, stress is going to increase your cortisol when it first starts to go up. Your body is set up to where you have a checks and balance system. And so when your cortisol goes up, your DHEA should go up with it, which keeps it from having side effects. When you continue to be stressed or be chased by a tiger, then what happens is your cortisol levels stay up, but your DHEA goes down. And when that happens, you get all the side effects of cortisol, which is belly fat, sweet cravings, insulin resistance, insomnia, brain fog, joint pain or pain all over your body. There's a lot of issues with cortisol that are a big problem. In our society, when you have stress, we give you an antidepressant, which really doesn't work. In older traditional medicines, they use adaptogenic herbs, which really seem to do well. And we always assess stress with a cortisol test that you do spit, you do saliva, 4 times in one day. And that gives us an idea of where you are all day. And then we review that and come up with a game plan to help balance that out. The next hormone is going to be testosterone. So testosterone is in men and women. It's obviously a lot more in men than it is in women. So starting around 40 years old, when women start to lose their testosterone quicker than men, that's when women start to have a problem with muscle loss and then body fat going up. When your testosterone goes down, you have problems with weakness, you can have depression, you can have problems with energy, and obviously your sex drive can go down. Now with the toxicity of the environment, we're seeing more and more people with low testosterone, and very seldom do I check a woman over the age of 40 who has normal testosterone, and very often men over 50 also have low testosterone. So let's talk about the elephant in the room. Is testosterone safe? Well, for men, they looked at it and said it does not cause cancer of the prostate. For women, I found it to be safe as long as it's given in the correct dosages, and it doesn't cause you to have oily skin or hair growth in places you don't want it, or acne. For guys, we just have to worry about potentially heart issues. 12 out of 14 studies that were done found that it was neutral in affecting the heart or actually helped the heart. It also keeps a guy or reverses the potential for having dementia and makes the bone strong. So estrogen in women, testosterone in men, both can be very helpful in the long run. The next hormone we want to talk about is progesterone. Progesterone is a hormone that's prevalent based on, when we say, the name of it is, which is progestation. It happens, it goes up right after you ovulate, and it's supposed to maintain a pregnancy. As women get into their 40s, their progesterone goes down. That can lead to sleep issues, menstrual irregularities, breakthrough bleeding, depression, anxiety especially. So some women just need to be on progesterone to balance out their hormones in their 40s, and we always check that as well. Next hormone I want to talk to you about is thyroid. So the estimate is that 30 million Americans have thyroid disease, but about 20 million of those are undiagnosed. 90% of people who have thyroid conditions still have symptoms even if they're on medication, and the main reason for that is that 90% of those people have autoimmune disease, which is never diagnosed or assessed. The main reason for that is that as medical doctors, we were trained that there is no difference between Hashimoto's or Graves' disease, the autoimmune portion of thyroid disease, or regular old run-of-the-mill hypothyroidism. Now that functional medicine has gotten more of a solution to autoimmune conditions, evaluating that condition as autoimmune disease can make a huge difference in your overall symptom relief, and we can really make a big difference once we know that whether you have autoimmune disease or not. The other thing is, remember that if your thyroid isn't working well, it could be your adrenals, it could be progesterone, it could be your estrogen, it could be any of your other hormones that are affecting it, okay, which is why we check everything. So what are the symptoms of low thyroid? You're tired all the time, you have weight that will not go away no matter how much you diet, you're depressed, you have dry skin, dry hair, your hair's falling out, constipation, you just don't feel good. I call it feel like crap syndrome, okay? There's a way to evaluate this the correct way. The most common test that doctors do is a TSH. That's the least sensitive test. We do a free T3, free T4, reverse T3. That ratio tells you how much T3 is actually in your cells, and a thyroid antibody test as well. Your thyroid produces T4, and then it has to go in the periphery and create T3. And if you can't do that, you'll have every single symptom of low thyroid. The final hormone I want to talk about is growth hormone. And growth hormone is the anti-aging hormone. It's what makes all of us young. As we get older, our growth hormone goes down. Most people don't talk about growth hormone because insurances don't cover it, and it's very expensive. Well, thanks to the peptide industry, we now have medical peptides in the United States, and those peptides can bring up your growth hormone level and enable you to reverse all the effects of aging potentially. What does that mean? It means you can have an improved memory, fantastic sleep, joint pain goes away, tons of energy, and you can build muscle and burn body fat. You can also get rid of those unsightly wrinkles and just look younger. So I hope that gives you an idea of all the different hormones in your body. If you'd like to have a consult with me and discuss your case more individually about yourself, I'd love to spend time with you and get you enrolled in a program that can improve your health and improve your overall outlook in life. Thanks again, and have a great day.